Hi, welcome. This is Jackie Cambridge. Welcome to one of our Take 5 videos to take 5 minutes on one aspect of health and safety. So in this video, we're going to have a look at wood dust. So it's a hazardous substance. It doesn't come in a bottle with a label, but it's an equally hazardous substance that if our employees are exposed to, we need to deal with it. Okay, so wood dust. If we're exposed to wood dust, we might breathe it in and that affects our respiratory system. But equally, wood dust, if we get it on the hands or the skin, it can cause dermatitis. So dust and wood dust, we measure dust in milligrams per meter cubed. So we can measure it, not easily, but we can measure it. The size of the actual particles are measured in microns, so thousandths of a millimeter. So if you have a look and you can see some dust in the air, that's going to be dust of about 100 to 10 microns in size. You can actually sort of see it. Then the dust that we're interested in is what we call inhalable dust. So this is dust that you can just about see. It's about 10 microns or less, and it's small enough to enter when you breathe it in. It will go up into your nose and your respiratory system. So that's inhalable dust. The more serious dust is what we call respirable dust. Now, this is dust that you possibly can't even see in ordinary light conditions, and it's less than 7 microns in size. And when you breathe it in, unbeknown to you, can breathe it in, and it's so small that it can get into the alveoli, the gas exchange area of your lungs. And once it's there, it's there. It's not going to be coming out again. Equally, we've got the dust itself. If the wood dust has actually been treated or painted in any way, that wood dust may also be more potentially dangerous because you've got the hazardous substances that it's been treated with as well. So that's a little bit on dust. So wood dust in particular. So wood dust, as some wood dust is classified as an irritant. So it can irritate the skin and the respiratory system. It can cause conjunctivitis, eye irritation, and if you breathe it in, coughing and sneezing. So it can cause an initial irritation, but it can also cause asthma where you get allergic to it. So in future, if you're exposed to that wood dust, it can trigger an allergic reaction. You can also get septic wounds caused by red cedar wood. So if you get like a splinter or something like that, that can be quite serious as well. If we have hardwoods, such as mahogany, you breathe that dust in, and that's not just as an issue in the lungs, but that can cause things like nasal cancer. So softwoods tend to be more causing asthma. Hardwoods can cause cancer, and they can cause some immediate reactions and also some chronic conditions. So with our wood dust, you breathe it in, it affects your lungs, get it on your skin. It can cause dermatitis, i.e. either irritant dermatitis or allergic dermatitis. So wood is a hazardous substance. It doesn't have a label on it, but it's a hazardous substance under COSH. So it has what's called a workplace exposure limit or level. So this is an airborne concentration that mustn't be exceeded in a typical day. And it's given over an 8-hour period or 15 minutes. So if someone's working with wood dust all day, there's a limit on how much they can be exposed to. If they're only working with it maybe to clean out a particular area for 15 minutes, then there's a different limit. So these documents are in these limits are in a document called EH40, and if anyone does any sampling for wood dust, they must use EH40 as their reference document to compare it to. But from an employer's perspective, what we got to do is to make sure that if there is wood dust, we make sure that people are not exposed to any more than the well, and exposure is as low as reasonably practicable. You can't put your finger in the air to do this, so you might need to do some sampling to check that exposure is below the well. So you might need to just take some personal samples where someone does some sampling where they check then how much dust is in the air. Regardless of that, though, we need to take some reasonable precautions to reduce wood dust. So in some cases, we now can buy the wood pre-cut. So it's been cut in a big factory where they've got all the right ventilation. We can automate or enclose the process to reduce the dust, but equally making sure we've got the right blades, the right drill bits, they're nice and sharp. That's going to reduce the amount of dust. We can have some additional local exhaust ventilation to extract the dust before it gets into the breathing zone of the worker. Depending on the levels, we may need people to wear proper respiratory protective equipment, not just an ordinary face mask, but to protect them. Even guarding on saws will direct, as you can see in the picture, directing the dust down rather than up into the atmosphere. Regular cleaning of the equipment in the area. We don't want lots of it, flat surfaces where the dust can accumulate. And equally, when we are cleaning, don't sweep, don't use compressed air. We should be using a vacuum to suck it away rather than blow it up into the air. We're interested in the wood dust issues for individuals, but if we have high levels of wood dust, that can also increase the risk of a fire or explosion. So thanks very much for watching. That's a little 5-minute tour on the hazards and risks of wood dust.